Great. Thank you so much, Megan. Hello, everyone. I'm so grateful to be here today. My name is Trish St. Ledger, and today we're going to be talking about diet, aging, and your brain. Right. So just a little background about me. I am a registered dietitian, licensed dietitian nutritionist, and I am the co-founder of Advanced Nutrition Consultants. I studied nutritional science at Penn State as an undergrad. And then for grad school, I did my studies at Marywood University and my dietetic internship through Geisinger up in northeastern Pennsylvania. Since then, I've worked in a variety of fields. I've worked in community nutrition with pregnant women and infants and children. And then I spent a lot of time working in long-term care, working with senior citizens, working in short-term rehab there as well. And I've also spent a little bit of time working in acute care in the hospital setting as well. But more recently, I've been teaching as an adjunct faculty member, teaching the science of nutrition. And currently, like I said, I work in private practice at Advanced Nutrition Consultants. So I am currently working one-on-one with patients most often, either in our office in East Norriton or virtually. So today, like I said, we're going to be talking about diet, aging, your brain, and what nutrition's role is there. We're going to get started with, some nutrition concerns that come along with aging. We'll talk about what are some of the risk factors. We'll actually have a little checklist and see what your risk is or your loved one's risk is. We'll talk about overcoming those barriers to healthy eating. So, there are a lot of barriers out there. What can we do to help either prevent them or overcome them? And then we'll talk about some of the specific nutrients that are of importance when it comes to aging. Finally, we'll talk about what are the best diets out there. There's so many diets out there, ranging from, the ones that I'll recommend, the Flexitarian diet, the Mediterranean, the DASH diet, and the MIND diet. And then finally, we'll talk about implementing changes for long-term success, things that I work with my patients for, not only, making changes this week, this month, but also, making lifelong changes there. So what are some of the nutrition concerns that come along with aging? To remember this, there's the word determined. We use this as a tool to remember the nutrition risks and those concerns with aging. D stands for disease, illnesses, chronic conditions that can affect the way that people eat. And it's not just, physical diseases, physical ailments, but also confusion, memory loss. All of these things can make it hard to remember what we ate, whether we ate, how much we ate, or if we even, had a meal in the past couple hours or, even the past day or so. Also, emotional health, feeling depressed definitely can affect appetite. For some people, it stimulates the appetite. For others, it suppresses the appetite. Both can be of concern when it comes to, a general overall health. E stands for, well, the first E stands for eating poorly. So poor nutritional health can be caused by, eating too much, eating too little, skipping meals, or even, people that are creatures of habits and eat the same thing every day. If that same thing that they eat every day is not nutritionally balanced, they may be at risk for lacking nutrients or malnutrition. T stands for tooth loss or mouth pain, dental problems. So poor nutritional health can be caused by also, dental issues such as missing teeth, loose teeth, poor fitting dentures. It can make it very difficult to actually physically chew and swallow your food. And so it can lead to, again, maybe not eating as much or eating maybe not the right types of foods to meet the nutritional needs of that person. The second E is for economic hardships. So we know as we get older, sometimes there can be economical concerns, money issues. People may be living on a reduced income, and they may find it hard to eat the way they once did, or the foods that they need can be a little bit more challenging to afford. R stands for reduced social contact. So having fewer contacts with other people can have a negative effect on one's morale, their well-being, and also their appetite. M stands for multiple medicines. So, as we grow older, it may change the way that older adults respond to these medications. There may be more drug nutrient interactions. So they may have to watch out for how much vitamin K they're taking if they are on a drug called warfarin, or, we may need to, watch certain foods like grapefruits if we're on statin. So there might be some drug nutrient interactions. And then also there can be side effects from being on multiple medications, such as constipation, diarrhea, drowsiness, nausea, or even changes in appetite. I stands for involuntary weight loss or weight gain. So when someone has an unintentional weight loss or weight gain over a certain amount of time, that can be of particular concern, especially in our older years. So this is something that could be a significant warning sign and should not be ignored. N stands for needs assistance in self-care. So, some older adults may have trouble walking, shopping, buying, or even cooking the foods that they once did. So they may need a little bit of assistance with the activities of daily life. And then the final E stands for elder years above 80. The risk can increase just as we get older. So especially once we get above the age of 80, there can be a risk of frailty or health problems that can affect nutrition as well. So what I'd like to do now is just go through this little checklist. This is the nutrition risk checklist. It's important to know these types of warning signs of poor nutritional health, the ones that I just discussed, the determined. This checklist can help you or a loved one learn if you or that loved one is at risk for poor nutrition. So what I'm going to do is I'll read through these statements, and if you answer yes to that statement, just jot down the corresponding number. We'll add up the total, and then we'll interpret those scores on the next slide here. So statement number 1, I have an illness or condition that has made me change the amount or the kind of food that I eat. If you answer yes to this, jot down 2. Number 2. I eat fewer than 2 meals every day. If that answer is yes, write down 3. I have 3 or more drinks of beer, wine, or liquor almost every day. If that answer is yes, jot down 2 points. I eat few fruits, vegetables, or milk products. If that is the case, jot down the number 2. I have tooth or muscle problems that make it hard for me to eat. If that sounds accurate for you or your loved one, jot down 2. I don't always have enough money to buy the foods I need. If that's an accurate statement, jot down the number 4. I eat alone most of the time. If that's an accurate statement, add 1 to your total. I take 3 or more different prescription or over-the-counter medications every day. If that's an accurate statement, add another point. In the past 6 months, I've lost or gained 10 pounds without wanting to. If that's accurate, add 2 to your points. And then finally, I am not always physically able to shop, cook, or feed myself. If that's accurate, add 2 to your total. So now I just want you to add up the total, all the tallies from this checklist. And let's interpret the results. So if your score is somewhere between 0 and 2 points, that's great. You want to continue to recheck your score every 6 months because we know that things can change as time goes by. If your score is somewhere between 3 and 5 points, you're at moderate nutrition risk. So we want to try to improve your eating habits and lifestyle. The general recommendation is seek advice from your Office on Aging, Senior Nutrition Program, Senior Center, or Health Department, or you may learn some things today that may help improve that score. And then finally, if your score is 6 or more, you're at a higher nutrition risk. So bring this checklist to your next appointment with your doctor, your dietitian, or other qualified health professional like a nurse practitioner or a physician assistant. And you want to tell them specifically about the problems that were listed. So what specifically made your score a 6 or higher? Please note that these warning signs will suggest risk, but they're not intended to diagnose anything. So if you have any concerns particular to yourself or your loved one, be sure to bring that up to your physician or healthcare professional. So in the meantime, we're going to be talking about how to overcome some of these barriers for healthy eating. There's a lot of barriers out there. I'm going to touch on 4 really important ones. The other ones, we probably won't get to all of them today, but we can certainly discuss a little bit further about nutrition's role and, other things that may help out. So overcoming barriers for healthy eating, the first one that comes to mind is poor appetite. Poor appetite can be common in older adults, and there's a lot of possible causes for this. It could be related to grief or bereavement, the loss of loved ones, fewer social contacts at meal times, acute or chronic illness, certainly, like I said before, can affect appetite level. Sensory changes, such as changes to vision or changes to your taste, changes to smell. This can come along with aging or chronic diseases as well. So that can definitely lead to a poor appetite. And then, like I said before, medication certainly can affect appetite as well. So what can we do to overcome those barriers? Generally, what I recommend is to try to increase the amount of calorically dense foods. So, getting foods that have more calories in a smaller package. Some examples may include nuts and nut butters, higher healthy fat foods. So things like olive oil and avocados, kind of sneaking those in to different recipes may help just sneak in extra calories that come in smaller packages. So it's less overwhelming to eat, as opposed to larger portions. So eating smaller portions and maybe eating more frequently throughout the day is another way we can sneak in some more calories. Also, just creating a positive atmosphere, adding a variety of colors and flavors and spices to the food, but then also the environment in which someone is eating can make a big difference too. So make it as pleasant as possible. Maybe light a couple candles, maybe have a nice tablecloth. It can really make a big difference. Next problem that is really common as we get older is dental problems. And chewing problems specifically. So chewing problems may cause older adults to overly restrict foods that are really important for proper health. A common problem I see is poorly fitting dentures, especially if someone has lost weight recently. It's very common to see that dentures may not fit as they used to. Missing teeth can also cause some problems with eating certain foods like fresh fruits and vegetables. And these are really important part of the diet because of all the vitamins, minerals, and fiber that they provide. So what are some ways that we can help with preventing these or overcoming these dental problems? Getting the right types of nutrients is important. And we'll talk about this in a little bit more detail, but as it pertains to dental health, calcium and phosphorus-rich foods are really important for dental health. Lower fat dairy products, dark leafy green vegetables are really good sources of calcium. And then phosphorus, some of the best sources are coming from our lean poultry and also seafood as well. It's important to regularly visit the dentist as well. Drinking plenty of fluids is also important for dental health and overall mouth health. And then if someone is having problems with chewing, we may want to look for softer foods. From my time working in long-term care with seniors, I've noticed that the biggest problem when someone has to eat softer foods is getting enough protein in there. So look for those softer types of foods, things like eggs or low-fat dairy products, yogurt, fish, beans, tofu, and then ground low-fat proteins like chicken and turkey as well. Mashed and pureed foods, when it comes to those fruits and vegetables that are so important, can also help as well if needed. Some other barriers to healthy eating include swallowing problems. This goes along with chewing problems. If someone's having trouble chewing, sometimes that can lead to swallowing problems. But someone with difficulty swallowing has that sensation that food is stuck in the throat or upper chest. This sensation can be felt high in the neck or lower down. And it can be a particular concern because if someone aspirates and food is, going down the wrong pipe, so to speak, ends up in the lungs, it can lead to serious complications and conditions like pneumonia. So what I recommend is if someone has trouble swallowing is to work with a speech language pathologist. They can do swallowing therapies to help improve those techniques for swallowing, provide strategies to just make it easier, or prescribe different consistencies of foods and beverages for their textures. They also may recommend adding sauces and gravies that may help with moistening the food, making it a little bit easier to go down. Some speech therapists and speech language pathologists may recommend avoiding hot foods or cold foods, depending on the person. Avoiding dry foods definitely can help as well. And if something is a little bit drier, again, going back to adding those sauces or gravies may be helpful. Cognitive impairments is another problem that can interfere with healthy eating. Cognitive impairments in older adults can range from minor memory loss to progressive dementia, and causes may include strokes, Alzheimer's disease, neurological disorders. And as a result, these adults may have a diminished attention span, particularly at mealtime. They may be at increased risk of choking or having swallowing issues. And they may have an inability to recognize thirst and hunger. They may not remember, like I said, if they had something to eat or when the last time they had something to eat. So again, what are some things we can do to help overcome this? Minimizing distractions is really key. So avoiding background noises, distractions, so that person can stay focused on the meal in front of them. Aim for consistency with timing and scheduling. So try to have something to eat every 3 or 4 hours can help. Sometimes putting foods on smaller bowls, smaller plates, and serving the foods one at a time can prevent that person from feeling overwhelmed. When I worked in long-term care, I'd often refer to an occupational therapist. They would be able to work with this person to, provide the best type of equipment and strategies for how to continue to have that independence to feed themselves, using things like weighted handled utensils, as you can see in that bottom photo there. Something called a nosy cup. That's the cup that has a little bit of an area where it makes it easier to drink for certain people, or a two-handled cup as well. So what does a healthy diet look like? This is a question I get all the time, of course, being a dietitian. And a lot of people will wonder, what are my calorie needs? And now I'm not big on counting calories. And I think what's more important is to understand that calorie needs are going to be vastly different from person to person. But as we get older, generally speaking, our metabolism does change. Caloric needs generally do decrease, not all the time, but generally speaking, they do. And caloric needs really varies depending on someone's age, someone's gender, their physical activity level, what are the activities of daily life that they are still able to do, their health status, body composition, muscle composition. There's a lot that goes into it. So there's no one right answer. I know some people like to say 2,000 calories a day, but I've met people that need 1,100 calories. I know people that need 4,000 calories. So really there's no one right answer for how many calories people need. What's really important though for a general healthy diet is getting in plenty of nutrient dense foods. Earlier, I talked about calorically dense foods. That means in a small package, you get a lot of calories, which is important when someone has a poor appetite. Nutrient dense foods are important for everyone. That means in a small package, you get a lot of nutrients. So these are foods that are high in vitamins and minerals and fiber. Examples of these types of foods are fruits, vegetables, and whole grains, and also other things like nuts and seeds and beans as well. Generally, a healthy diet will limit things like trans fats. Trans fats are also known as hydrogenated or partially hydrogenated oils. So really, that's the one food that I will tell people to try to avoid. It's something that the general recommendation is try to keep that level to 0 grams a day. So if you ever see anything with hydrogenated oil, try to stay away from that. That's in a lot of our pastries and baked goods, but it can also be snuck into things like, you know, peanut butter and popcorn and pancake mix. So anything that has a longer shelf life, always take a look at the ingredients and try to avoid anything that has hydrogenated oils in it. We also want to limit saturated fat. Now, we don't have to avoid this completely like trans fats, but we do want it to be a smaller percentage of our diet, less than 10% of our total calories. We want them to be from saturated fats. We also want to avoid excessive sodium and excessive added sugars as well. So what are some of the specific nutrients that are of importance as we get older? I touched on calcium earlier, and calcium and vitamin D are both really important for bone health. And of course, we know that as we get older, bone density can decrease. And so it's recommended that adults that are older than 70 years old get a little bit more calcium and vitamin D to help maintain bone health than they did in their younger years. So to meet these needs, we want to make sure that we're getting calcium-rich foods and beverages. If someone can tolerate dairy, you know, the general recommendation is try to go for lower fat dairies to cut back on the saturated fats. But you can also get calcium from things like fortified cereals, fortified juices, although we do want to keep an eye on how much juice we're having. But especially important is getting things like dark leafy greens in. Canned fish can also be a good source of calcium. And then for vitamin D is a little bit harder to get enough of from the diet. The best source of vitamin D comes from the sunshine, from the UV rays. And so being in Pennsylvania and going into these darker days where the sun sets earlier, vitamin D may be a little bit harder to get in the winter time. So supplementation is often recommended, but it's important to also try to get enough from the foods as well. So things like fatty fish, such as salmon. Sometimes the eggs also have vitamin D in the yolks, and fortified foods will have some vitamin D in there as well. Vitamin B12 is a water-soluble vitamin that is important for older adults. Some adults older than the age of 50 may not be able to absorb as much vitamin B12 as they once did. B12 generally is coming from animal sources, and we'll talk a little bit later about trying to get more plant-based foods into the diet. So you can also get B12 from fortified cereals, fortified grains as well. But generally you can get B12 from animal sources. So like lean meats, fish, seafood in general are pretty good sources of B12. Omega-3 fatty acids, I'm going to talk about this a lot throughout the day. They are particularly important because of their benefits. They play an anti-inflammatory role in the body. So getting enough omega-3 fatty acids is important. Best source definitely coming from salmon, but we can also get from other fatty fish as well, like mackerel and tuna, sardines. And then also certain nuts and seeds like walnuts, flax seeds, hemp seeds, chia seeds are also good sources of omega-3 fatty acids. Dietary fiber is really important. Getting enough fiber can help in so many ways. It can help us stay full longer. It can help manage cholesterol levels. It can help keep the gut nice and healthy. So getting things like whole grain breads, whole grain cereals, beans, peas, lentils, And also just generally our fruits and vegetables are good sources of dietary fiber. And potassium, a lot of times when we talk about, things like blood pressure, we focus on, limiting sodium, but getting enough potassium is also helpful for lowering blood pressure, which can be important for preventing things like strokes and heart attacks. So getting enough potassium in from things like tomatoes and potatoes, bananas, citrus fruits, generally our fruits and vegetables are excellent sources of potassium. So let's go into a little bit more detail about this healthy diet. So basically what a healthy diet looks like based on what I've been describing is something that's nutritionally balanced. It's going to meet all our macronutrients, meaning our carbs, fats, and proteins, and all our micronutrients, meaning our vitamins and minerals. And the best diets that are out there with the most evidence and research behind them are generally under this umbrella term called anti-inflammatory diets. Those anti-inflammatory diets are the Flexitarian diet, the Mediterranean diet, the DASH diet, and the MIND diet. So I'm going to go through these one by one, starting with the Flexitarian diet. There we go. And just like the name suggests, it's a flexible vegetarian diet. So it's a vegetarian diet with maybe a little less rules, a little less strictness to it. So basically, a flexitarian diet is something that's primarily plant-based, getting plenty of plant-based proteins in there, getting plenty of fruits and vegetables, focusing on those plant-based proteins such as beans, legumes, soy products, nuts, seeds, and then getting generally some animal products is allowed when it comes to flexitarian diet. So generally we try to stick to things like chicken and fish and turkey, and trying to keep it 2 to 4 times a week, although there's no real rules when it comes to how many servings is recommended with the flexitarian diet. Some low-fat dairy is allowed, like yogurts, milk, occasionally cheese as well. But generally with a flexitarian diet, we're limiting red meat and avoiding processed meats like lunch meats, hot dogs, bacon, that kind of thing. We're also trying to limit added sugars and sweets and getting, like I said before, plenty of vegetables and fruits and whole grains. The next diet is one that a lot of people have heard of. There's a lot of research to back up the Mediterranean diet. And basically some of the recommendations when someone's trying to follow a Mediterranean diet is to eat these foods daily: vegetables, fruits, nuts, seeds, legumes, potatoes, whole grains, plenty of herbs and spices, and then also those healthy fats coming from things like olive oil and avocados, avocado oil, walnut oil, olives, that kind of thing. Then generally around 3 or 4 times a week, we're trying to get in fatty fish. So again, things like salmon, mackerel, tuna, sardines, shellfish, and other seafood also allowed 3 or 4 times a week. And then poultry, kind of similar to the flexitarian diet, 2 to 3 times a week, having things like, chicken and turkey, also some dairy and eggs as well. And then just limiting to once a week or less, we're going to be trying to limit things like high fat red meats, the refined grains, and simple carbohydrates. And on the next slide, I made a nice little food pyramid, even though we have retired the food pyramid in the nutrition world. I like this just as a general reference for what a Mediterranean food pyramid would look like. What are we eating on a daily basis? As you see, it's very colorful down there. We have plenty of colorful fruits, vegetables, nuts, beans, that kind of thing, healthy fats, the seafood 3 or more times a week, especially getting in salmon at least once or twice a week. And then at the top of the pyramid, what we're trying to limit is our dairy, poultry, eggs, and definitely trying to limit the meats and sweets at the very top there. The DASH diet is another diet that I recommend often, especially when someone has high blood pressure. So DASH stands for Dietary Approaches to Stop Hypertension. So generally there's a large excuse me, a large focus on lowering sodium in one's diet when someone's following a DASH diet. And just like calories, the recommendation will vary depending on the person. But it could be somewhere between 1,500 to 2,300 milligrams of sodium per day. This diet also focuses on getting a lot of nutrient-dense foods as well, especially those potassium-rich foods. So getting 4 or 5 servings of vegetables a day, getting plenty of whole grains in there. 6 to 8 servings is what's recommended in a day. Dairy is recommended 2 or 3 servings a day for the DASH diet, so it's a little bit more than compared to the other diets. Lean poultry, meat, fish, 6 ounces a day or less. So again, there is some limit there, but a little bit more than some of the other diets out there. Nuts, seeds, beans, legumes, we're going to try to get at least 4 or 5 servings every single week when we're on the DASH diet. And then those healthy oils that I mentioned earlier, we want to try to get at least 2 or 3 servings a day. And then for things like sweets and added sugars, we try to keep that to no more than 5 servings a week. And then finally, I saved this one for last, the MIND diet, because it's a combination of the Mediterranean and the DASH diet. This is a newer diet. I believe the first published articles studying the MIND diet came out less than 10 years ago. So the MIND diet, what it stands for is MIND, so Mediterranean Dash Intervention for Neurodegenerative Delay diet. Like I said, it combines portions of the DASH diet and the Mediterranean diet. Both of those diets have been shown to help improve cognition, but particularly with the MIND diet, what has been researched is looking at how many servings of dark leafy greens and what types of fruits people are eating. So what the MIND diet recommends is getting 6 or more servings of dark leafy greens every single week. So that's almost every day, trying to get a serving of dark leafy greens. Berries are very rich in antioxidants. And what the studies have shown is that people that are eating more berries throughout the week tend to have improved cognition. So getting in those very colorful blueberries and raspberries and blackberries at least twice a week. And I know in our area, berry season is over, unfortunately. They're very common in the summertime, but you can do not just fresh berries, but you can also do frozen as well when it comes to the wintertime, and that can help save a little bit of money as well. For nuts, again, we want to try to get at least 5 servings a week. And the reason behind this is because of all those great monounsaturated fatty acids and even some omega-3s from things like walnuts as well. Fish it's recommended to get at least 1 serving a week, but more is better. Beans 4 times a week, poultry 2 times a week. And with the MIND diet, they do recommend 1 glass of wine, red wine specifically, a day. If someone's not a wine drinker, that's okay. You do not have to drink the wine. Speaking of beverages, I get a lot of questions like, can I drink anything besides water? Does it have to be just water? And of course, water is important for our overall health, but there's also been some research to support drinking things like teas, herbal teas, especially green teas and black teas may help with our cognition and our overall health as well. Coffee is absolutely fine as well. We just want to be careful with what we add into our coffee, you know, how much cream, how much sugar, that kind of thing. Smoothies and shakes, especially if someone's not a big berry eater or, you know, even those dark leafy greens, sometimes you can sneak them in a smoothie and drinking them can be a little bit easier than sometimes eating them for certain people. When it comes to alcohol, generally the research just supports drinking red wine because of the resveratrol, which is a powerful antioxidant in red wine. If someone's not a wine drinker, I tell them you can also eat grapes, especially those red and black grapes. You can still get resveratrol from that as well. So don't force yourself to drink wine if you're not a big wine drinker. And it's also important to be aware that some medications, you're not supposed to be drinking any alcohol with it. So it's always good to talk with the doctor about that before starting that. Now, when it comes to other beverages, a lot of beverages consumed in the standard American diet can be very high in sugar. And just to use a point of reference, we want to try to limit our added sugars to no more than 24 grams a day for women and no more than 36 grams a day for men. These are the recommendations put out there by the American Heart Association. And so you take a look at this little table here. And now orange juice, if it's 100% orange juice, it's not going to have the added sugars that are naturally occurring, but still it's very high in naturally occurring sugars, which we also want to try to limit. So just in an 8-ounce glass, we have 22 grams of sugar. Now, more importantly, we want to look at other things like colas and sodas. And, just look at that iced tea. That's a standard, like if you go into a Wawa or convenience store, I should say, for those that are not from the Philadelphia area, and you pick up just a bottle of iced tea or sweet tea, that has about 42 grams of added sugar, which is more than a day's worth for both women and men. So it's important just to use that number as a frame of reference and try to limit our sugar that we get from beverages. My recommendation, if someone is a heavy juice drinker or soda drinker or iced tea drinker, to make it a little bit easier to transition, just try diluting it. Try adding some water to your juice. Maybe you pour a couple ounces of your OJ or your apple juice in the morning, or your lemonade or whatever it is. And that will have not too much added sugar in it. And then you can add the rest with water. And that way you get a little bit of the sweetness, but not too much at the same time. So putting it all together, I know I talked about a lot of diets, but what did they all have in common, right? The trends that we saw between the Flexitarian diet, the DASH diet, the Mediterranean diet, the MIND diet is we want to eat more fruits and berries, whole fruits, trying to avoid things like, fruits with added sugars or concentrated fruits like juices, and try to get whole fruits, especially berries, in on a regular basis. Getting a variety of vegetables, including a variety of colors, allows us to get different types of antioxidants, fiber, and vitamins and minerals. Getting in plenty of fish throughout the week is recommended. Focusing on healthy fats while limiting the not so healthy fats like the trans fats and the saturated fats. Trying to get more whole grains and avoiding refined grains and simple carbohydrates and sweets and treats like danishes, muffins, that kind of thing. Focusing on getting plenty of plant-based proteins. And when I look at the standard American diet, this is something that generally is lacking, is not getting enough plant-based proteins from things like soy or beans or nuts or seeds. And then what we want to try to limit in our diet: butters, margarines, cheeses, high-fat cheeses especially, red meat, fried foods, pastries, sweets, especially those that have those trans fats that I mentioned earlier, and then excessive amounts of alcohol. So here is a sample day for someone trying to follow an anti-inflammatory type of brain healthy diet, and when it comes to general meal plans, it's so hard because everyone, like I said before, there could be someone that needs 1,000 calories a day. There could be people that need 4,000 calories a day. So, the numbers here, the serving sizes will definitely vary depending on the person. But just take a look at, more importantly, is what types of foods are being provided. We have whole grain oats in the morning. We have low fat dairy, so we don't get too much saturated fat. We add a little bit of milled flaxseed to get some omegas and a little extra fiber in the morning. We have some antioxidant anthocyanin rich blueberries in the morning as well. We do a low fat, like a plain low fat, low sugar Greek yogurt to get a little bit more protein in there, get a little bit more calcium, which is especially important as we get older. For lunch, we're having a whole wheat pita to get a little bit more fiber in there. Maybe have some fish at lunch with some tuna, try to get the ones that are packed in water. Getting in plenty of colors when it comes to our vegetables. So maybe we have tomato, maybe we have lettuce, maybe we do a darker green, like some spinach in there, or some Swiss chard. We have red onion, maybe half an avocado for some heart healthy fats and brain healthy fats. And then for some more complex carbs, we add an apple. Then as a snack, maybe we have some baby carrots, sugar snap peas with a little bit of hummus as well. Dinner could be something plant-based. Maybe we have some firm tofu with a peanut ginger sauce. And I didn't get to talk too much about spices, but ginger is another really a good spicing food in your diet for overall anti-inflammatory reasons. Brown rice to get a little extra fiber compared to the white rice, or maybe we try to get a little bit more plant-based protein by adding in some quinoa or other types of ancient grains. Then maybe we have some broccoli with a little bit of olive oil as well to get some more fiber in there, get a little bit more color, and then get a little bit more of those good fats. Then finally, for dessert, a little bit of dark chocolate, which can be rich in those antioxidants. We just got to be careful with how much. So keeping it to 1 ounce and then pairing it with another serving of berries like strawberries would be great. So finally, I want to talk about you and the changes that you're going to implement or your loved one. So what I want you to take from this is focusing on what are some short-term goals that I want to work on. It's important to have big long-term goals as well, but it's important to look at these short-term goals as the little stepping stones to get you there. So little changes really make a big difference. For example, if someone I'm working with says that they have red meat a couple times a week, maybe they do, ground beef tacos, and then they have burgers, and then they have a steak, I'll say, okay, a little short-term goal is maybe choosing 1 day a week to eat red meat and then looking for swaps those other days. Another goal could be, I will plan to eat seafood twice this week. That's another, a goal that could have a really good effect on the diet in terms of anti-inflammatory reasons, brain health, heart health, all of that. And then think about swaps. If someone is an avid ice cream eater, eating ice cream a few times a week, and we try to decrease that to maybe once a week, what are some swaps I can do instead of just saying, I'm just going to stop eating ice cream, which is easier said than done. Maybe instead of eating ice cream during the week, I'll try to have a Greek yogurt with some berries and some dark chocolate chips on there. And maybe some crushed walnuts too, or pumpkin seeds or something. And then planning ahead is really important as well. So maybe plan out what meals you want to have throughout the week. That can help with the grocery shopping. It can help you make sure that you have all the foods that you want to eat throughout the week in the house. And then, like I said before, focus on just a couple things to change. Don't think you need to do a dramatic overhaul of your diet to be, following the Mind diet or the Mediterranean diet to a T. Focus on little changes and then consistently improve upon them. And over time, voila, you'll have a lifestyle change. So it takes effort and it takes consistency, but you can do it, especially when you ease into these changes. So I want you to think about what are some of your goals. Maybe write down 3 goals that you wanted to work on based on what you learned from today. And I have some references and some future reading materials, some good cookbooks at the bottom there about just the general anti-inflammatory diet, which again is kind of umbrella term for all the types of diets that we talked about today. And then finally, just want to thank you for your attention today, and I welcome any questions that you may have.